You shouldn't be sitting on the toilet for 10 minutes, I would say, baseline. That's too long.
Right. You waited until you had to go again is what happened.
Right. You just waited all the
And then it's like I was there for 5 hours, and then I had to go to the rest.
My name is Shana Hoke. I'm a pelvic health specialist, a physical therapist, and I'm joined here today with Krista and Francesca, and we're here to just talk about all things pelvic health in the time that we have, and for you to ask questions. We can go over any specific concerns and really just talk out loud so that if anyone else might be curious or wondering the same things, maybe you'll find something interesting throughout our conversation. So we can start just pretty general. Some people are not sure exactly what pelvic health is or what's involved, what could it be useful for. So are there any questions that you guys have just right off the bat?
Yes, I actually do. When we talk about physical therapy for the pelvic area, how long would we be in therapy where we would actually start seeing a result?
Yeah. So similar to if you're going to pelvic or physical therapy for any other part of the body, it really just depends on what's going on, how long it's been going on, the severity of it, and a lot of other internal personal factors to that person as to how long it might take. So generally speaking, I would say things that you've been dealing with for longer may take longer relatively, and vice versa. So it's hard to give like a number to it, but I usually tell anyone coming in for their first visit that give it at least a month to like see some sort of change. It could happen sooner. It could take longer, but giving it at least that month in the beginning to like give yourself the body to respond and make changes or habits. It takes some time. So.
And are the sessions an hour or less?
Here, I guess it depends on where you're practicing, but here at Better Physical Therapy, we have an hour for each session one-on-one. That goes for our pelvic patients as well as our orthopedic patients or anyone else coming in for something else.
And it's internal, correct?
I actually do a great deal of a session that's not internal or hands-on at all. It certainly can be, and it might be helpful, but it doesn't mean I have to. Same thing if it's like we're working on your knee. Maybe we'll work on some things on your hands on your knee, but it doesn't necessarily have to be. It depends on what the person is looking for if they want to do that. But and it can be helpful, but it's not a requirement to attend pelvic therapy.
I didn't realize that. I thought it was all internal.
Yeah.
So I kind of feel like that goes to, we were talking prior, to her observation that you've been working out more lately and working on your core, and you've felt that
has helped a lot.
It has helped a lot. So I think that speaks to it's not always internal. There's other supporting things that you would be working on that would contribute.
More so even. Yeah, than the internal. It can be helpful if, evaluation components, like just to really know what's going on and visualize the tissue or feel the muscles and get even that proprioceptive feedback from me so the patient can feel that. But again, it can be a good, useful part. And certainly for some people, I really encourage it and do, but it's not, we find a lot of benefit in other ways, like other modalities, whether that's exercises or, other distal parts, but the core and your abdominals being a big part. But yeah, general exercise goes a long way too, right? As you can imagine.
Right. Yeah. So, but when we talk about workouts, with this area, should we focus more like on yoga or Pilates? Is that more helpful for the pelvic area, or just in general, just work out and throw everything into the mix?
I think that, again, it really depends on what's going on and what someone's looking for. I do think something like a Pilates is really, it's a good adjunct to pelvic therapy, and we do a lot of things very similarly in focusing on like the core in that way, but it's certainly not like the only version of exercise I recommend or have people follow through with. And I think weight training and resistance training is a big part of it. Yoga is good for mobility too, so it's never just one thing that it's like this is going to be for your pelvic floor and this is going to be for these other muscles. I think you can use a lot of different versions of movement and exercise to get at different goals, just depending on how you engage in it. But certainly Pilates is kind of a easy transition, and we do a lot of Pilates-esque types of exercise and movements in a session here.
So you mentioned, I heard you mention, depending on the goals or the
Mm-hmm.
individual. I feel like maybe if we jump back a step, what are some of the
Yeah.
different things that somebody might be experiencing that they would come that would warrant, hey, maybe it's a pelvic health issue that I should just get that assessed. Like, what are some of the
Mm-hmm.
typical things that you see, and maybe even some of the things, we're talking about if you're talking about women, but maybe some of the things that one wouldn't think. Because I did ask some friends before I came here. I'm like, all right, what do you know about pelvic health?
Yeah.
What do you know about pelvic physical therapy? And do you guys have anything you're dealing with? And I actually had one friend my age, you chime in and say, oh, I'm lucky. I haven't had any issues with that. And I'm thinking, girl, I bet you have, but maybe we just
We
don't
just
know
don't
it. Yeah,
know
exactly.
that it stems from
Or
that, right?
people think it's just aging, or this is what happens, and
Yeah.
what is typical, and what is not. So what are some of the
Yeah.
things that people experience, and then that would bring them to you, and then what is reasonable,
More,
yeah, and
yeah, that
more
they
like,
wouldn't know.
right.
Yeah, that's exactly why we were having the conversation, because it's like to bring awareness to that. And there's those obvious things, like leaking, like incontinence, belt issues, and or sexual dysfunction. Maybe that's even like a lesser known, but those might be the obvious. Like, this is my pelvic floor.
Right.
So
But
anything
bowel issues, meaning like not just like constipation can be, as well as
constipation,
you were
fecal
saying fecal
incontinence. Yeah, so there's
incontinence you
incontinence,
mentioned.
both urinary, fecal.
Hmm.
Um, it's way less common because most people don't mention it, just because it's somehow more shameful for people to talk about, even to their providers. So people live in silence a lot within that particular symptom. But yeah, that's something we treat. Constipation, as you mentioned, even just difficulty voiding, incomplete emptying. These are all things that are, yeah, that's in the pelvis. I get that. Uh, Perinatal, prenatal, postpartum, that seems to be more like of the obvious reason someone might seek out pelvic therapy. And then there's the less obvious, like maybe just persistent back pain, and that you've addressed, through physical therapy, looking at your back, looking at your hip pain, and your pelvis is kind of that place right in between, right close to the area that I'm not saying it has to be, but it can be a really useful place to also evaluate and intervene, and make sure these muscles are balanced and working as they should, in the same way that you'd evaluate other parts of your back in that area close by. So I would say back and hip pain. Um, those kind of come to mind as like, oh, I didn't think maybe someone with that specialty might offer something useful.
Right.
Yeah,
So worthy to explore that. So you're really taking a look at the whole picture and making sure
exactly.
what might be
Yeah. And
helpful or not.
yeah, and back to your point, Francesca, like, yeah, it doesn't mean you have to get an internal exam to figure out what's going on. It could just be like really some specific questions, or like just things to consider in awareness of that area that can play a role. I think a lot of, we talked about prolapse a little bit earlier before this conversation. Like, what is prolapse, and can it be a pelvic floor issue, like a weakness or an imbalance, or is it more like a pressure management thing, like being able to manage your pressures when you move and lift or do things, and that can be something worth exploring too. And pelvic therapy is a good place to like learn about that too.
Right. And I also found it interesting. I'd heard that I feel like back in the day, because I have a back in the day kind of age on me, that it's like all you heard were like, oh, Kegels and strengthen and strengthen and strengthen. But as I'm learning through you and in discussions, it's not always, sometimes being too strong or too tight is not
Mm-hmm.
good either. Sometimes it's a relaxation or learning how to be more, I don't know, I guess relax is the word I'm looking
Yeah,
for, but maybe you can
mobile,
professionally
mobile. Yeah, yeah.
provide a word for it.
Yeah, one of the top conversations I have with most of my patients at some point in their care is they bring up Kegels. They're like, "Oh, I'm not doing enough," and it's usually oftentimes not what they actually need to address what they're experiencing, and it might be a part of like their care in some version, but it's not usually just to like get strong and more and more and more. It's like any muscle too. You want that balance of strength and mobility or flexibility, and you can't just go one direction, and that could be contributing to some symptoms rather than helping. So it's usually just teaching full control over the muscles rather than just one direction of like train strong and tense and more.
Right.
And yeah, getting that balance of control, like, oh, I can be strong, but I can also be relaxed and actually that's specifically with incontinence too. That's the big misconception is like, well, I'm weak, and that's not always or often the case that it's a weakness issue. It could be, but I don't usually spend a whole lot of effort just straight strengthening for something
so
like
it's not
that.
just weakness, it's control
Control,
around.
right? That's a good way to put it. Yeah, control.
And that's where I feel like at least like getting evaluated.
Yeah, to know.
Like,
to know.
somebody who's like, to your point, like at home, be like, okay, I know Kegels, I'm weak, I got to do Kegels, and maybe that's not the right thing.
Exactly.
And you would be able to advise
And
on that.
there's so much research to support that people that are doing Kegels, on their own or because they think they should, probably aren't doing them right anyway. Yeah.
That's what I said in our conversation earlier when I was talking with Krista. I'm like, I feel I don't know how to do Kegels. I feel it feels weird to me. I feel I use my stomach. I don't know how to do them. And I've never done them because I feel I try to start to like, oh, let's like squeeze and tighten. And I feel like I'm really just using my stomach muscles, I feel, all the time and not the right muscles to
Yeah, it's hard they're really hard to isolate because they're not used in isolation. There's no moment of your day where you're just sitting there and functionally that's what you're doing. Your pelvic floor is integrated into all your movements. Like when you're walking, you don't think, okay, I'm gonna flex my calf with every step. It's happening all by itself without you having to do it. And can you do a calf raise and a heel raise by yourself and turn it on? Yeah, and it might be useful to like give some extra strength there if you need to. So it's the same thing. We want to train the pelvic floor integrated into the system that it's used in, which is it's like a postural muscle. It's there reflexively and automatically for you. And yeah, we might spend some time try to find it isolated so you can like get that better control and like see where maybe the deficits are. And I might spend some time in a session we learn that and like really hone in and laser focus on it. And I can help do that through like hands-on feedback or like I just cueing you through it verbally, giving you analogies and things to imagine it, which do help. And then you maybe have a better sense of how to bring that into your more functional movements. But yeah, it's I think for most people, like you said, it's really that's their main thing. Is like I don't feel like I'm doing it right. It feels weird. I'm using other things, and that's what we try to work on in a session, perhaps, and how to better integrate it into other things. Yeah.
Now you mentioned intercourse could be affected by pelvic floor. See, now I never realized that. Like, what would some issues be there? Like pain? Could it
For
be
sure,
pain?
for sure, pain. That's probably the bigger one that people will have. So we think of sexual dysfunction, like what is that? That could be anything it's not comfortable, it's painful, even just like pleasure, like that's not something necessarily that I see a whole lot come in by itself, like that on its own, but can certainly be impacted if your pelvic floor is functioning and healthy. So pain's a big one. So working on whether that is that muscular driven, is it like nervous system driven? Usually it's both. Sexual activity is very multifactorial and like the experience of it all. It's never just like a physiological, mechanical thing. So we take that into play. And I'm not a sexual counselor by trade or training, but I do discuss that aspect a lot and make sure someone's getting support in that realm too. So like cognitive behavioral therapy or sexual counseling or training, partner, therapies, that all helps with that. But from pelvic health perspective, yeah, working on anything muscular or tissue related that can be at play. Usually it's like that relaxation piece that we're talking about, not strength necessarily.
You're right, it is multifactorial.
But I'm wondering, Do you see more of that after women who've had children?
No, actually, not
No.
necessarily.
Oh,
No,
okay.
I would say it's pretty balanced between, yeah, maybe more pain after like a delivery or injury during delivery or something like that, or driven by hormonal changes postpartum, like dryness or something. But I often see those that are, haven't had any pregnancies or deliveries, or that have a lot of pain from just pelvic floor dysfunction.
Okay.
That stems from like really long
Right.
term, really.
I was going to bring in like kind of also like the psychological factor too, because
Yeah.
if you're experiencing a little pain,
Mm-hmm.
then you're probably worried about it going
Oh yeah.
into the activity, and then that could create an issue, and that also probably coming for help may just alleviate even some of that. Even though you're not a psychologist, you're not a sex
Oh yeah,
therapist,
yeah.
just the fact that somebody's taking the step, like I just find it myself. So even if you're like whatever, sort of
Make the
once you make the
appointment.
appointment for the doctor, you're like, okay, I feel better because I know I'm addressing it.
Someone's
So
gonna
it's
take care
almost
of me. Yeah.
like okay, let me let's find out, let's get to the bottom of it, and then maybe mentally too, it kind of lets you release a little bit. But it also brings me back to something you mentioned in one of our meetings about you see a correlation with people who like have clenched jaws can also relate to pelvic health. And so like maybe not just post birth or whatever, but people who are carrying a lot of tension around in ways that maybe they don't even realize,
Yeah.
could also be that contributing factor as well.
Yeah, there's a interesting. You just ask folks coming in for pelvic stuff. You can tell by the way they talk or breathe that they're. You just say, "Hey, you also have jaw pain," and often if they're coming in for some sort of pain issue or tension, high pelvic floor tone dysfunction, that also happens to be the case. It's not what they're coming for. Maybe it doesn't bother them, but it's like an interesting little correlate. But that I won't necessarily, you know, directly treat. Maybe, but it's bringing their awareness to that kind of gives them the picture of like, oh, this is not just in my pelvis. It's like my whole system. That's what it comes down to. It's nervous system wiring, and we were talking about the psychological component of sexual dysfunction too. Yeah, you're right. I think just offering the support and acknowledgement that there's other things might be going on, it helps also take the pressure off it. It's not just your body and like something wrong with your body, and me trying to help you through it physically in a way. Yeah, I could talk at length probably about the sexual part about it, I think, because often then it's like someone like maybe that has long-term history of pain with intercourse, maybe always had issues with their gynecological exams or putting in a tampon, or even something as simple like that. Like it's not any type of like penetration or insertion there too. That's only one version of, I guess, what I help people with in that realm.
And what's interesting too is almost with anything, especially something that personal, it's like you only know your experience. How do you know what's normal and what's not normal? Whatever other people experience, what they don't. I mean, unless you're having conversations with somebody who might be like, hey,
totally.
but in general, like some people experience their life and like, oh, I didn't realize that was not normal, or that's pain, or it shouldn't be painful, or I should be experiencing something different. So,
and people don't like to share that either, that they don't enjoy intercourse or it's an issue. But
yeah, everyone's pretty cool with saying like, oh, my back hurts, because everyone knows that, everyone's experienced at some point. It's it's not taboo, but that's exactly again why we're here to talk about it, because this topic, for whatever reason, is just more taboo, and even with close friends and family, it doesn't come up organically over the dinner table, and so or the Thanksgiving table, and it does take more like
past the
layers.
Peas. And speaking of pee,
so
let me tell you something.
Yeah, exactly. It doesn't, or like even patients when they're coming here for it in my room are even so shy. They're like, is this too much information? Is this TMI? Like, sorry if that. I'm like, no, that's why you're here. That's why we're talking about it. Because, like, to your point, it's just no one else told them it wasn't normal, or maybe even other friends and family are like, oh, me too. And so, like, oh, it's normal for them. It's normal for me. It's normal then. baseline, then that's where we have like our standards aren't like set correctly.
Right.
Yeah.
Right. And it's where the
That's
exploring.
just raising awareness of that all. That's all.
Right.
The more people know, then they can just seek help for even like minor things that they might not see as a big deal. Like, a little dribble here and there. It's not totally life changing, but it's annoying. But that can compound or grow into something maybe more disruptive in your routine over time, gradually, that you didn't even realize, and then you're like changing your schedule, or you're making choices that are based around your symptom, and that what started out as not a big deal is now more impactful. So
that's what happened with me. It was getting out of hand.
Yeah.
And it happens so slowly sometimes that you don't. Obviously, you realized it, but I find like even in general PT stuff, when people call about a problem, it's like, oh, how is it affecting your daily life? And they're like, oh, not really. I'm not really. But I'm like, are you waking up in the middle of the night? Oh yeah, it bothers me. I have to roll over. I'm like, well, then it's affecting your daily life because it's going to snowball, and eventually, people just kind of slowly get used to things.
They cope,
right?
And that to them is like, oh, it's not bothering me, but they didn't realize it could be better, right?
Right. It's like, oh, they make poise pads. That's fine. Everybody must struggle with it. Let's just stick a pad versus, wait, maybe I can address this.
It's a strategy for coping, rather than a solution.
Right.
Like not going on the dance floor right away.
Exactly.
I'm always afraid that I'm going to leak.
It's a perfect example.
That is, I'm telling you, I would run off the dance floor.
Yeah.
And John would be like, really? Be like, we just got out here. I'm like, I gotta go. And I would run off. And then I'd come back. And then it was always the constant urge.
Mm-hmm.
I always had the constant urge. I have to go to the bathroom. I have to go to the bathroom.
Yeah.
Even though I went 3 minutes before.
Mm-hmm.
Which brings me to medication.
Mm-hmm.
Because I don't know how you feel. Like, I know as a physical therapist you wouldn't, but I was by a urologist. Oh, let's try medication. I got it, but I feel that I'd have to be on it forever, which didn't make me happy. I mean, was stretching. I think it was to stretch the bladder so it could hold more. I'm looking at you because you're sitting next to me. Do a lot of your patients, do they say that they're on medication for this as well? I think it was more to stop the idea of the urge of having to go.
Yeah. I'm glad you brought that up, actually, because people are often prescribed it, and it's a really good tool. And I think that's the same sentiment I get from people, like, well, if I'm gonna have to take it forever, I don't want to start it and it become reliant on this and that. But it can be a really useful. You don't have to pick PT or medication. You can do both. And what the medication allows in extreme situations, let's say it's an urge medication, that's what I'm assuming you're talking about, like an overactive bladder medication, like oxybutylene or something like that. Those are the most commonly prescribed. And I also, if someone's not on that and we need some help in our therapy, I'll have them maybe inquire about that to their provider, because it can just help us manage our symptoms while we're training, bladder training, other things that we might be working on. It can just be like a helpful symptom management so that you can get to that next level and then maybe wean off of it. So it doesn't have to be a forever thing. And that's the worry, I think, for most people. Think of it like if you're coming in for really severe shoulder pain or back pain or neck pain, and you can't participate in your PT because it's just so intense, maybe you'll take an ibuprofen or a pain medication, not forever, but just to manage the intensity of what you're experiencing so that you can engage in the intervention here better and feel more successful, and then you can wean off of it. Do you know what I mean? Build that strength or build those habits and patterning and eventually, yeah. So I don't feel against them. I'm not ever needs them. It's what you need, and some people do fine without them. Some people really do need them, especially for certain scenarios. Really, their nighttime is really tough, and that's what just helps them get some sleep, and then we can move forward. So I think they're really useful for some folks, and you didn't try it then? You didn't try them?
No, I was prescribed them. I took it, and I didn't take it. let me rephrase that. I didn't take it because I don't like taking medication for long periods of time. I felt that was a long period. So I never started them, but I was prescribed them, but I never took them. I also, which was prescribed, and I never say this correctly, like the guy,
Pessary?
pessary.
Am I saying that?
Yeah.
Oh, okay.
That's,
Look
we
at
talked
you.
about those the other day, right? Like briefly.
Yeah, we probably did.
I brought it up.
Okay. Pessary as
Yeah.
well.
Yeah.
I have tried that. I do find it helps, but it doesn't cure everything.
Yeah.
It,
Yeah.
it helps, but obviously I have a lot of issues with the urinating. But yeah, the medication. How do you? I don't know. Go to Krista right now because I do have I have a question.
Well, let's go
And
back
this
to.
might see.
Go
Go ahead.
because I was going to launch into something different.
I-
Go
So
ahead.
Well, I would just to kind of comment on what you're talking about. Like, I was given this idea, and it's hard to navigate that too from different providers, and like some of it's on like they just kind of give you the pester with a lot of. You don't see your doctor as often as maybe you would come see a PT, and public PT can also just help you navigate that journey of like figuring it out how it works into your life. So pessary is again something I counsel a lot of people on. I don't do fittings myself, though some PTs are trained to do that. I leave that to the provider, and I can just help you with like the management of it, and even just suggesting it at the start, like how if you're a good candidate, we can always. I'm a big proponent for like trialing it, and it can be like again really useful to managing symptoms while we build the strength, or even just using it when needed. I think there's this idea that like once it's in there, it's there forever. It's like my crutch, and I can't take it away, but it can be more fluid than that, the use of a pessary, and there's all these
wear it
different
on
types.
the dance floor, but
Wear
you
it on
don't
the
have
dance floor.
to go
Exactly.
dancing.
No, that's brilliant.
Exactly.
Yeah.
But that's
what I mean.
I would
Right.
do. I would be
Right.
like, well, I have an event.
That's
so
right.
Now I need to use it, but I don't like leaving it in there all the time.
So
But
Dr.
is that
Shana says you don't have to.
No,
you
I
don't
don't.
have to, and
It should come in and out. You need to take.
everyone
that
has
out
a
to
different
clean.
like level of comfort with just like how long they want to leave it in, the cleanliness. Everyone has different just comforts or discomforts surrounding it, so it's my job to just sort of educate on making people feel more confident in using that kind of device if that's what they need. And same thing with medication, just managing it, and maybe even just having them be able to go back to the doctor and ask the right questions if they have concerns. Again, not my job to prescribe or tell them how to come off or when, but to give ideas on like how it can work into their life. But yeah, pessary is super useful.
Like it's kind of like it takes a village kind of deal.
Yeah, everyone has different, and like you see your PT a little bit more often, and that can, more things just come up with more contact and conversation.
I also feel like these days with healthcare and doctors and insurance and everything, it's like you get ticky-tack, you get 15 minutes with your doctor, and it's like hi.
Yeah.
Whereas in physical therapy, you really are one-on-one, and it's you get maybe a little more conversation,
more personal.
So, right.
Yeah, you see that, you build that. So you might find it doesn't even come to your mind. You just because you're with them somewhere, more things come up.
Yeah, you feel a deeper connection.
More information is
I know, and we may not have to jump on it, but talking about women the whole time, men too, right?
Oh,
it's not, what are the things that men would experience that would be pelvic health or pelvic physical therapy related?
For sure. Correct in that males also need pelvic therapy. I think obviously when you think of it, you think of more like female conditions just because of anatomy differs and maybe more at risk for certain other things. But males have a pelvic floor too, similar muscles really, just one less hole. And they can experience incontinence, they can experience voiding issues, they can have constipation and back pain, they can have testicular pain, penile pain in all that. They know the regions that are in the pelvic area, and sexual dysfunction, and certainly
so for a male, sexual dysfunction, because obviously men and women differ. Sexual dysfunction for a male would be,
well, they can have pain too. I know that that's not always the what comes to mind.
Right.
They can. It can be erectile dysfunction. And
so
those are
that can be helped with physical therapy. It's not just go sit yourself in a bathtub somewhere with a Cialis and right, like
yeah.
those commercials they're like sitting. My God,
No, I think it's I would say it's not everything too, in the
Yeah.
same way that there's other factors that are involved with erectile dysfunction. It's not always simply physiological, and there could be medical stuff going on that's not PT might not change. But it certainly could be muscular in some component. So it's worth, I think, the idea is like if someone's experiencing that it's medication or nothing, or like it's
Right.
or there's other devices and things too, but maybe being more curious about what's driving it
Right.
can be interesting. Like even just let's talk, there's postural impairments that might contribute to blood flow everywhere. So it's just worth exploring. Maybe not it's not going to be like the thing everyone's missing, but it can be a nice, it can be nice that, and most people I would say aren't coming in just for that. Usually they're coming in for something else, and then it comes up, and then we can like talk about it.
Right.
But there's usually, I think, more play with, again, the psychological component too can be the case. It could be a vascular issue. You don't know.
Right.
But it's something to consider. Certainly post like prostatectomy is a big population too. Prostatectomy or prostate cancer treatments, radiations,
and so
surgeries,
pelvic
floor
PT
therapy
will help with that.
Very recommended to do it even before surgery. Can help a lot with recovery. I see really good outcomes with people that are coming in prior to their surgery to build that strength, to build that awareness of those muscles that are going to be impacted during those treatments, so that they can have like a faster recovery and better recovery. And I do find that
surgeons and doctors are recommending that at all, or even mention that as a suggestion to patients? I mean, I know
not
you're
as much.
okay.
Not as, it's not, but better. It's getting better, I think.
Yeah.
But certainly
After
it's not the protocol. After right now,
after this, we're starting the trend. But
no, I'm glad you brought that up. Yeah. The protocol is, I don't think it's the protocol. Like, oh, you're gonna have surgery, so I want 4 weeks before I want you to go to PT. Like that's not like a knee replacement. We're even still trying to get that to be better.
Yeah, I know. I see it more and more now. To your point, with like knee replacements are
better.
Pre-surgery, people are coming for like a few weeks or even longer to get strong first.
Helps so much.
You're right. So it's like, why not? Why not that too?
It's mostly the patient advocating for themselves. I find like, hey, what should I do to, like, someone bringing it up? Like, do you think I should do this? Or someone else told them they should, but I don't know that it's the protocol of like a standard. Yes, before you do this, like before you have the colonoscopy, you have this thing you have to do to prep.
Oh yeah, right.
But where there's no prep, I know it's not the same thing.
I know
it's not
right.
There should be some prep. It's like a big event, right?
Right, and many men have prostate cancer.
I mean,
that's right.
You would think that they would start to say, "Hey."
It helps so
but
much.
It's also, I feel like it's
can't hurt.
Right.
No, I feel like women so much more advocate for themselves a little bit more, or are more prone to seeking help or going to the doctor. And I'm not.
That's a generalization.
I know it is a generalization.
So that's
but I do feel like a lot of men don't, or may as embarrassing as it might have felt for women to talk about it, men are probably even more
silent.
So maybe we can break that stigmatism, but I find more and more these days, no matter who it is, no matter what doctor or profession, like you do have to advocate for yourself. And there's so much out there that you can find. I feel like maybe with pelvic health, there's not quite as much out there yet that makes it like, oh, let me arm myself with this and walk in there and say, like, this is what I'm saying. I feel like this is going to be helpful. Like, let me ask you for this. Just right, like all the drug companies are like, oh, ask your doctor about it. Ask for this medicine specifically. It's like, go ask your doctor for some maybe physical therapy help that you can.
Yeah, it's the same. Like, I'm just bringing up a knee replacement again. Like you might go to your doctor armed with questions because your uncle had it and your mom had it. Like so many people and you've talked about it, and it's like this. People just have more background and even just expectation. Whereas these are people aren't talk. I think it's getting better, but it's not like as much talked about where you have the confidence, maybe even know what to ask.
Right,
Yeah.
right. So there's, I feel like there's not as much information to arm yourself with. So people kind of assume, or I feel like the overall, it's an aging thing. It's post, post having kids or menopause. But I was intrigued to find out that it's that student athletes or younger people, physically active and maybe not even struggle with it, and actually pelvic floor therapy is indicated at that point too. Like, what have you seen? What have you come across?
Well, yeah, I'll say it's the same. Like everyone has a pelvic floor their whole life, right? So in any point in your life, we're even talking pediatrics, can go through pelvic rehab. And I personally
pediatrics,
I don't treat pediatrics at this point, but that's a whole realm, and because they have a pelvic floor too, and they don't do any hands-on anything. It's a lot of good education for parents and habits and things. A lot of kids suffer from constipation, or like bedwetting, things like that. And so that is someone that PT can be well equipped. And I shouldn't keep saying PT, I should be saying pelvic health provider, because OTs do this, and other special disciplines can be a pelvic health provider. So physical therapy, that's another thing. So it's not just physical therapists, occupational therapists, other specialists that's in their scope. But yeah, pediatrics can have.
Do you find
with too?
So I'm sorry, now I'm intrigued. So with pediatrics, obviously there's been more awareness of children with ADHD or anxiety issues and all that. Yeah. Do you find that co-commit?
Oh yeah, I think it's the same in adulthood. Same idea.
Right.
Same thing with pediatrics. And I said I don't treat them, so I don't necessarily have experience.
No, but it's a good thing for parents to even think about, because especially as a kid, you probably don't understand. Like, oh, maybe something's not right now. Like, they don't know what, like,
they can't even tell you, right?
Right. So it might be you can ask some questions, and maybe this isn't the place to start laying out those questions, but they're for a pediatric focused person, they'd be able to do it. But or they to just have, again, arm yourself with the fact that that's even a possibility. Ask your provider, hey, should we be exploring this, or is there, how can we make sure that's now not another issue for my child that they can't express to me? So
yeah, hopefully, I think maybe a pediatrician would also be, they know to refer in that case, because it's.
But I would hope so.
I think so.
I would hope so.
Yeah, I'm not in that one.
With what they're seeing here, that hey, you know what, because that could also be contributing to concerns for the child
and their adulthood, issues.
Right. Yeah.
Like, things don't they can start really early on.
Yeah.
Right.
Yeah. Interesting.
Adolescents or athletes too. Your pelvic floor works in the system of your whole body, and operating at like higher impacts or higher intensities can kind of draw out those dysfunctions, those two. So I'm thinking a lot of like gymnasts and hot those, like the impact
hockey players. Don't they always do their exercises to loosen their hips and their pelvis?
They need good mobility. Yes.
Right.
Their inner thigh muscles. Yes. But yeah, it's anyone with a pelvic floor, they have it throughout all their whole lifespan. So it's not just the perinatal, it's the perimenopausal, postmenopausal, male, it's pediatrics, it's adolescents. Right. It's good to know it's out there as an option.
Yeah, or just that something worth exploring.
Yes, exactly. But were you gonna ask a question?
No, it's all right.
Sure.
Like, let's say you're urinating and you're sitting there and you're urinating and you're done. But when you stand, you could sit there for 10 minutes and knock up. But as soon as you stand, you wind up having to go. Like, you go.
Mm-hmm.
Does that have anything to do with the positioning of anything down in that pelvis area? Or is it just how it is? I feel there's something off.
There's something with the position change.
Yes.
Yeah. Yeah, there could be a few different things I'm thinking of as to why that's happening. Again, another common problem people come to me for, like, I get up and then I dribble some or something like that.
Yeah, like a position
Yeah.
change, and you could sit there for 10 minutes and be fine, and then get up.
Yeah, right.
So, wondering, does this have to do with the muscles now again? Is it an issue? Or is it
Yeah.
something down there not in place?
Could it be that, your pelvis sits in one position in certain ways and your organs are resting in some orientation, and then when you change that orientation, the bladder that sits in the pelvis also changes position, and that can, let's say it's a prolapse that shifts, and then the remaining urine or liquid in, like, the urethra or the bladder just can shift and change once you stand. Could it be that you're creating a pressure to come up because you're standing up takes some effort? It creates a pressure change that can also have an impact on that. So could it be even this is like a more abnormal scenario? There's like a diverticulum, which is like a little pocket in your urethra that can also change. It's like a little pocket that fluid might get trapped in. There's just things on your differential that you might think about. But I think it's usually the pressure change and how your muscles are then differently tensioned to around the pelvis in that way. But it can be, I guess, a couple different things, but you shouldn't be sitting on the toilet for 10 minutes, I would say, baseline. That's too long.
Right. And then you stand, I'm like, oh my gosh.
So you waited until you had to go again is what happened.
Yeah. Right. You just waited all at once.
And then you stood. It's like I was there for 5 hours, and then I had to go another way. Well, gee, Fran.
Yeah. Okay.
It's important to know that your bladder is never 100% empty. Never. By design, it's not meant to be that way. And so I think there's people try to sit there to, like, empty everything out. But what should happen is when your urinary reflex is done, like you've urinated, the flow, the stream happened, and then you're done. Like, the reflex is that it's stopped. Your sphincter, which is like that closure, is adequate enough to stop anything, even whatever's left in there, which should be some residual volume in there. And if you're having some leakage with a positional change or an urgency that happens, to me, it's again, it could be a couple different things. So I don't want to say just
right.
one certain thing, but it could be a prolapse that, the some that got caught somewhere then shifts out. Could your sphincter, have like a loss in tone at that moment, or pressure that is put upon it? I mean, like I said, it can be a couple different things.
Okay.
Yeah, but it's well within the scope of PG to figure it out. So thanks for all your questions. It's really, I hope, learned a few things. We could talk at length about any, like, individual thing.
Right.
In the bowel department and the urinary department, and
I would love
like
bowel department, but
the bowel department. The bowel department. That's another thing. People don't want to talk about poop as much as, like, other things, I guess.
Right.
Yeah, I talk at length about that all the time, so don't feel shy. We can definitely pick up here again, but thank you for joining us. It's really fun. Yeah.
Answer some of my questions. So I appreciate it.
I'm so into this, like a TV show.
We should have had models and visuals, I feel like.
I know.
I feel like that people love, like, visuals. Just so you know, that's going to be in the bloopers.
Say no more.
We'll
Can I get some music and candles?
We'll just, like, hop up on the table. We'll give you the demo right here.
Just like with people.
Break that out on your Thanksgiving dinner. Move that turkey.
Or use the turkey.
Take the stuffing out. Take the stuffing out.
Laying on the table.
Okay.
We'll just have this here.
I've been rejected.